Good afternoon, Dominic Hyson. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses, and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities, both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
Why did you choose OET?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I chose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals. I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in the present days, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother that I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system, and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Your preparation time is over. You can now start your roleplay.
Hello, Mihiraa. My name is Wilson, and I'm one of the nurses here. I'll be helping with your checkup today. I can see you seem a bit upset. It's completely okay. You're in a safe space here. My job is to listen and help. Before we begin the physical exam, I'd like to talk with you for a few moments. Can you tell me what's been on your mind lately?
Oh, thank you. I've just been feeling a bit embarrassed. It's hard to talk about.
I understand it can feel difficult. Please don't be embarrassed. To help me understand better, could you describe what's been troubling you?
Well, it's a problem with my bladder. I keep needing to go to the toilet, and sometimes I don't make it in time.
Thank you for telling me. That's very important for me to know. To get a clearer picture, can you tell me more about your condition and how it affects your day?
It started a few months ago, just a little leak now and then. But it's gotten worse. Now I need to go very often, day and night, and sometimes if I cough or move quickly, I leak a bit of urine. It's very distressing.
I appreciate you sharing those details. It helps a lot. While this is going on, how would you describe your general health? Have you had to change your daily activities because of this?
My general health is okay, I think. But this problem is making me not want to go out. I've stopped meeting my friends for coffee because I worry about finding a toilet in time. I even worry about going to the shops.
Thank you for explaining. Mihiraa, based on everything you've so kindly shared with me about the frequent need to go, the unexpected leaks, and how this started a few months ago, what you're experiencing has a name. We call it urinary incontinence. I want to take a moment to reassure you about this, because it's very important to understand what this means. First and foremost, this is an incredibly common condition, especially for people in your age group. You are not alone in this, and there is absolutely no reason for shame. Secondly, and most importantly, it is very treatable and manageable. We have several effective strategies that can make a significant difference. The goal is to help you regain control and confidence. This condition does not have to define you or limit your personal life. With the right support and plan, you can absolutely continue to enjoy your daily activities, meet friends for coffee, and live your life fully without this constant worry. We are here to work with you on that plan.
Really? Is it treatable? I thought it was just something I had to live with.
Absolutely, it is treatable, Mihiraa. There are several good strategies we can use, often in combination, to improve this. One common strategy is called bladder training, where we slowly and gently extend the time between your bathroom visits, which helps your bladder gradually hold more urine comfortably. Another very effective method involves learning simple exercises to strengthen your pelvic floor muscles. These are the muscles that help control the flow of urine, and strengthening them can provide much better support. In some cases, medication can also be a helpful option to relax an overactive bladder. Each plan is tailored to the individual. Do you have any specific questions or concerns, Mihiraa?
The exercises sound good and could be doable. And what can I do right now? It's still happening.
Excellent question, Mihiraa. For right now, the next steps would involve two things. First, I can help you schedule an appointment with a specialist doctor called a urologist. They can give you a full assessment and guide you on the best treatments, including those exercises. Secondly, for immediate management, you can use continence pads or disposable undergarments. They are discreet and can give you confidence while we work on the long-term solutions. Would it be all right with you if I went ahead and scheduled that appointment with a urologist for you?
Yes, please. That would be a big help. And I'll look into those pads as well.
Of course, Mihiraa. I'll get that arranged for you right away. So, to make sure we're both clear and you feel supported, let me just summarize our conversation. You bravely shared with me that you've been dealing with a very personal and concerning bladder issue, involving frequent trips to the toilet and some leakage, which has sadly led you to stop some of your social activities. We discussed how this is a common condition called urinary incontinence, and I want to reinforce that it is very treatable, and you do not have to just accept it. We talked about several paths forward, like bladder training and pelvic floor exercises. And for immediate help, you can use discreet protective pads. Most importantly, you've agreed to schedule a specialist appointment with a urologist, who will be your partner in creating a tailored plan to manage this effectively. How does that plan sound to you now?
Yes, it does. Thank you, Wilson. I feel much better and less worried now.
You're very welcome. That's what I'm here for. I'll get those appointment details sorted for you right away.